Hello guys, let's talk about the antiemetics classifications, uses and their side effects. Drugs causes vomiting are called emetics. Classification of emetics are centrally, peripheral, both acting. Centrally acting are morphine, periphery acting are mustard, tartaric acid and mixed are ipecacuanha. The act of vomiting is controlled by vomiting center in the medulla. Stimuli are relayed to the centers from periphery areas like gastric mucosa and other part of GI tract. Sensory stimuli also arise within the CNS itself, that is vestibular apparatus. You can see the classifications of antiemetics drugs. First one is 5-HT3 receptor antagonist drugs are ondansetron, dolutegravir, bromotegravir. You can see their mechanism of action is they act on release of serotonin from enterochromaffin cell of intestinal mucosa and block impulses to CTZ and STN center of the brain, and hence control of vomiting take place. Let's talk about next classification, that is prokinetic drugs contain metoclopramide, domperidone, chlorpromazine. They act on both central and periphery, block T2 receptors and increase gut peristalsis movement, increase tone of lower esophageal sphincter and relax pyloric sphincter, and enhance forward movement of content in the GIT and hence control vomiting. It does not have a significant effect on motility of the colon. Next classification of antiemetics is NK1 receptors, that is neurokinin 1 receptors. Their mechanism of action is they block neurokinin receptor and hence decrease substance P in CTZ and NT. They are highly effective in prevention of delayed emesis following moderately or highly emetogenic chemotherapy. Next classification is histamine receptors blocker. They are mainly useful for prevention of motion sickness. These drugs block H1 receptors that have antiemetic properties. Hyoscine is the drug of choice of motion sickness. It blocks efferent impulses from vestibular apparatus and hence block ACH and control nausea, vomiting. Next classification, cannabinoid receptor antagonist. It suppresses CTZ center and hence control vomiting. Benzodiazepines binds to GABA receptors and hence decrease dopamine release and no CTZ stimuli. Last one is dexamethasones, decrease activation of NTS and control vomiting.